We are live now. We are live now. Joginder
Okay.
sir, you can start.
Yes, that's very great. Good afternoon and very warm welcome to everybody. Thank you all for joining us today as we bring to you a unique series called Saturday Learnings. This new initiative by Hero Mind promises you to bring to you people from all walks of life, the captains from industry and other walks of life, every third Saturday of each month to deliberate upon very pertinent topics. The uppermost question on our minds under the pandemic is when will the vaccine come? How will this COVID be managed? So, therefore, we have all seen that this coronavirus pandemic has flipped our personal lives, our professional lives, our work lives upside down and have created completely new paradigms for us. But what happens on the other side of it? We are already seeing the effects of crisis on our expectations of how do we work, how do we engage in personal engagements with each other, with social distancing and all other things coming around. While some of these changes would be temporary, many of them would be more like permanent, and we have really coined a new word for them as new normal. How and in what way this new normal will open, we'll have to really see. And I have wonderful people to deliberate upon that topic. With me, we have Mr. Kaustav Ganguly. He's managing director of Alvarez and Marshall, and he would delve into the life post-COVID and if the vaccination is going to be as effective a solution as it is touted it to be, and we are expecting it to be. And with our esteemed panel of doctors from the Anand Medical College and Hospital, I would request Kaustav to introduce the panel and take over from here. Thanks, Kaustav, and thanks, doctors.
Sure. Thanks, Jogendraji, for that kind introduction. Quick introduction from my side. I'm Kaustav Ganguly. As Jogendraji mentioned, I'm a managing director with Alvarez and Marshall, which is a large global management consulting firm. I lead up the healthcare and life sciences practice for Alvarez and Marshall in the region, and by way of that, I advise large healthcare groups on their performance improvement and growth, and also advise large global investors or private equity funds on potential investments in the healthcare sector. So that's really a quick introduction from my side. I'll now go ahead and introduce my esteemed panel. Today we've got three eminent clinicians with us: Dr. Sandeep Puri, Dr. Vishab Mohan, and Dr. Rajesh Mahajan. All three of them from the Dayanand Medical College and Hospital, one of the largest and most preeminent hospitals from the northern part of the country. I'll start off with the introduction to Dr. Puri. Dr. Sandeep Puri, he's the principal at DMCH or Dayanand Medical College and Hospital, and he's a professor of medicine. During his career, Dr. Puri has supervised 35 theses. He's participated in close to 10 multinational clinical trials, and published close to 60 articles in various journals and books. He's the chairman of the PF Board of Studies, BFUHS, and a member of National Academy of Medical Sciences. Dr. Puri, it's a pleasure having you with us on this panel today. Next, I'll introduce Dr. Vishab Mohan. Dr. Vishab Mohan is a professor of cardiology at DMCH once again. He also has had experience of working in clinical research on various task forces for ICMR. And Dr. Mohan has, once again, through his career, published more than 100 papers in national and international journals, and is on the editorial board and a reviewer of various national and international journals. Once again, Dr. Mohan, welcome to the panel. Look forward to interacting with you through the course of our interaction over the next 1 hour. Thirdly, today we've also got Dr. Rajesh Mahajan. Dr. Rajesh Mahajan works in the area of medicine and critical care at the Anand Medical College and Hospital. He does research in internal medicine, general medicine, toxicology, and infectious diseases. His most recent publications concern, continuous EEG monitoring in patients with non-traumatic coma in neurological ICUs. So once again, a very big and warm welcome to all three eminent clinicians on our panel today. I'll first request Dr. Rajesh Mahajan to start off with a quick presentation, post which will actually delve into the topic of our discussion today, which is really focused on what to expect by way of the rest of the COVID journey, how to individually manage post-COVID complications. What is it that India should really expect in terms of the remainder of the journey? And also, very interestingly, what should we as a country be looking forward to in terms of vaccination, in terms of the government as well as the private vaccination program? So I'll take a step back and request now Dr. Rajesh Mahajan to come in and make his presentation.
Good afternoon. I think my slide is visible.
There are two
I
devices which
request
are.
everybody to go on mute except Dr. Rajesh Mahajan. If
I
everybody
think
here on this
my
call can
slides
go
are
on mute.
visible now.
Yes, Dr. Mahajan, it's visible. Thank you.
Yeah, the thing is ki I'll be just starting with the it's a case summary ki like what the patients are going to have. This is the one patient's elaboration ki like how he has said that once he has COVID. So he said my wife, kids, and I had the symptoms of the presumed COVID-19 on early April 2020. They were soon fine, but he was the one who was unwell and ended up in the bed, extremely fatigued, lethargic, and without appetite. The only person whose symptoms persisted for a long, and it becomes difficult to engage fully in day-to-day activities with the normal energy level. He used to do regular exercise, but now he was unable to do that, and within next 72 hours he was sweating a lot and he was having persistent headache which was not getting relieved. Chest was becoming tight and his breathing was becoming erratic, and he started having the shortness of breath. And at that time he noticed that he has a loss of smell for the last 1 week, and then he started having these things. As far as the recovery goes, it has not taken for full 7 to 8 weeks to start feeling close to his normal routine. And in the aftermath of this, he started continuing to experience that he started having the fatigue to a point to having sleep in the day, inability to exercise, continued shortness of breath, both motionless and when exerting, and small waves of anxiety and considerable depression and continued loss of smell. These were all post symptoms once the patient who initially were not having any other medical history, so which was difficult to wrestle and difficult to manage in the continuous setting. So it may take some COVID-19 patients more than a year to fully recover from the lingering symptoms. Most common things are the fatigue, shortness of breath, and brain fog are the most common things. And unfortunately, this is going to persist. And that's why these patients are being described as that they have been labeled as the long haulers or post-COVID-19 syndromes. So what is it is the most commonly seen in the older people and the people who are having underlying comorbid conditions like those who are diabetic, hypertensive, or who are having underlying coronary artery disease, or who are taking steroids. But this can even happen there in the young or otherwise healthy people can feel unwell for weeks to months together after the infection. The most common thing which they used to feel, which linger over time, is fatigue, shortness of breath, cough, joint pain, chest pain, and few people can have the muscle pain, headache, tachycardia or fast or pounding heartbeat. They use loss of smell or taste, which can persist, memory, concentration or sleep problem, rash or hair loss. So the post-COVID-19 syndrome, it has been labeled medically that this is a multi-system disease, sometimes occurring after relatively mild acute illness. That means the patient who only had mild fever and they came out to be COVID positive, they can have this thing. And they can recover spontaneously with holistic support, rest, and symptomatic treatment. Approximately 10% of the people which we are having is that they can have prolonged illness, and most of the time the home pulse oximetry, I'll be just touching the things, what are the things which we can do at home also that will be taken care at that time. And broadly we can divide this patient into those who are having serious sickly or those who are having mild non-specific clinical picture. The basic reason is that the persistent viral infection, viremia, which can cause to weak or absent antibody response, or patient can have the relapse, or they can have the reinfection in next 90 days. They can cause the body inflammatory or immune reactions, which can cause long-term respiratory, musculoskeletal, or neuropsychiatric sequelae have been described in these patients. Other symptoms, like I have already said, is the patient can complain shortness of breath, chest pain, or mental health conditions can be there in these clinical settings. The most commonly what the patient used to have is it's the worrisome cough which is going to persist. And the most of the time they will say that dry cough, which is very troubling, and especially during the night time. And along with that, patient used to have the breathlessness. The breathlessness, the various things which we can do at home is the most of the time we are breathing with our help of our diaphragm. So these patients should sit in a supported position, breathe in and out slowly, preferably in through the nose and out through the mouth, and while relaxing the chest and shoulders, allowing the tummy to rise. They should aim for an inspiration to expiration ratio of 1:2, and this technique can be used frequently throughout the days in 5 to 10 bursts, and this definitely is going to help to take care of their breathlessness part. Other things, like in India, we can do the yoga, pranayam, and the deep breathing exercise which can help in these conditions of the patient. Then the patient used to have the fatigue, the profound and prolonged nature of fatigue in some post-acute COVID-19 patients share features with the chronic fatigue syndromes, like which were observed in other viral infections in these things. Cardiopulmonary complications have been very well known, and various imaging tests are taken after months have shown that the patient is having lasting damage to the heart. So in case if somebody is the patient who is going to have the chest pain or breathlessness, or they can have the tachycardias in these patients, that would be due to the post-COVID complication which can be there. Then the type of pneumonia, because many times you people have heard about the people used to say that they used to have the breathlessness, or even the oxygen requirement is there in patients who have been sent home on the oxygen therapy. And it is basically due to the long-standing damage to the tiny air sacs in the lung, which causes the resulting scar tissue, which can cause the long-term breathing problems. Then the patients can have the ischemic stroke, seizure, encephalitis, and various neuropathies where the nerves are going to get involved. These things can happen in those clinical settings. Other non-specific neurological symptoms which seems to co-occur with fatigue, breathlessness, including headache, dizziness, and sometimes the brain fog, like the cognitive blunting, has been seen in these clinical settings. Older patients, they are having more problem with these things. They are high risk of sarcopenia, malnutrition, depression, and delirium. Post-COVID-19 chronic pain may affect patients of any age, but seems to be commoner in elderly patients. Physical symptoms and to the psychological impact of the disruptive steps to the healthcare. They can have the core personal routine problems can be there, social interaction problems can be there, and it is going to affect the professional network support problems. Various people can have anxiety, stress, and condition related to the broken routine, loneliness, and social isolation in uninfected individuals, low mood, hopelessness, heightened anxiety, and difficulty in sleeping can be there. Post-traumatic stress disorder may occur, especially in the healthcare workers and other with caring responsibilities. then definitely family bereavements as well as the job losses and consequent financial stress and food poverty has been seen in these patients who have suffered with it due to the COVID. So these were the things which has been observed in the post-COVID syndrome, which has been described in the literature and what we are seeing for the last 10 months in our clinical setting. Now few words about that, because a lot is being said, like, okay, there are no exact treatment modalities which are available for this thing and only prevention is available. Definitely, as per the various international forums and even the government guidelines says, mask, social distancing, frequent hand washing, and avoidance of going to these public places is going to prevent. And the other thing medically which we can do is the available of the COVID vaccination. But then it comes like, who is going to get it? It will be prioritized even in India. First, frontline workers, first responder like paramedical staff, civil servant, police, army, politician, their relatives will get it first. People more than 50 years of age and those with comorbid illness like diabetes, hypertension, transplant, and chemotherapy will get it next. Then will be healthy adults, teenagers, children, and last neonatal, if at all it is to be given. What the government only 4 days back has rolled down the COVID program for the vaccination, where they have identified about 1 crore of the healthcare workers, 2 crores of the paramedical staff, other people who are involved, frontline workers, and then the 27 crores of the Indian population, which will be, they will be prioritized and they will be given the COVID vaccination. Then comes the how much is the recommended dose and schedule. 2 doses given 21 days or 28 days apart, depending on the vaccine used. Till today, Indian government has not decided on which vaccine is going to be used. And then it will be the vaccine schedule is going to be 21 days or 28 days apart. And you have to get both the doses, because one dose will give only partial protection, maybe 60 to 80%, and will not last long enough. And for complete protection, you must take 2 doses at the recommended intervals, because what we have seen in our neighboring state are the somebody whom the ministerial staff who has got the vaccination and then later on get the disease itself. It is not basically due to the disease. It is basically because adequate protection was not there after one dose. Then do you need to take it even if you had the corona after how many days of getting? Yes, anybody who is going to get the corona, they can get it, but they will be last in the priority list, because you can let others who probably need more than you might need it earlier, but if you don't develop any symptom and antibody response, then you can be. Somebody who has received the plasma, they can also get the, but they should be aware that they are already having the immune response to this viral infection, and they can easily wait for 3 months. And after that, once somebody who has totally recovered, and after waiting for 3 months, they can get the COVID vaccination done. And what are the side effects? Because a lot of things what we are learning is from the social media, where it has been told, and especially in India, what we used to have is the negative propaganda which is happening. The side effects which has been reported are mostly mild COVID-like symptoms, like somebody can have the fever and fatigue. You can have the local site injection pain and induration can be there. Reports of transfer mellitus and Bell's palsy, facial palsy, which has not been found to be related to the vaccines. Generally, all vaccines are safe, although these vaccines have made in a record time. Testing methodology and procedures has not been compromised even during the development of these things. Then in northern India, because there is a lot of alcohol intake, many people used to have this query whether there is an interaction of alcohol and COVID vaccine. We know that excess alcohol can reduce the immune response to vaccine. Since Russians are known to be heavy drinking, so that's why their government has advised to avoid drinking for that for the Sputnik vaccines. And occasional glass of wine or beer will not interfere with the immune response. What is CoWIN? What is the Indian government rollout program for the COVID vaccine? This is the CoWIN app which has been launched by the government of India. It is the world's first digital end-to-end vaccine distribution and management system. It includes the beneficiary registration, authentication, document verification, session allocation, and adverse event reporting and certificate generation. Once the vaccine is available, you just have to got yourself registered at CoWIN application. It will generate an SMS informing the beneficiary about the time and when you will be getting a vaccine. The vaccine center itself will be managed by about 5 people, and they will give maximum 100 vaccines per day. The vaccine recipient has to wait for 30 minutes before leaving the center post vaccination, just to see in case if there is any adverse event due to the vaccine. What are the different types of the query used to come like the people are listing a lot of things which vaccine is going to be available for near future. Till today the Pfizer has got a approval, and now yesterday only then the US Moderna vaccine, which are both are from the US, and they are consisted of messenger RNA molecules. They carry the code messages which include the human cells to manufacture spike proteins or the coronavirus, and these proteins are recognized by our immune system to produce the antibodies. So this was the what Pfizer and Moderna which is being used. The only problem is because these are the messenger RNA vaccine, their storage is a very big problem. Pfizer need a storage of -70 degree, Moderna needs -20. So it will be difficult for, like, especially in India, to maintain these storage units in the country. Another vaccine which is going to be the Covishield, which is by the Serum Institute of India. It is with the Oxford University and with the AstraZeneca. It is again is a non-replicating viral vector vaccine, and these are the virus that has been modified to act as a delivery system that carry the viral antigen to our immune cells. And like in the for the as Serum Institute or the Oxford vaccine, the chimpanzee adenovirus has been used, and for the Sputnik, human adenoviruses has been used. Then another is the which is the Bharat Biotech with the ICMR. It is a whole cell inactivated vaccine which is being developed in India, and it has undergone phase 1 trial. Most of the current vaccines are the killed viruses, like which we are already using in our country, and they produce immunity but cannot cause the disease. So the people are having the various misconception, like once they will receive the COVID vaccine, they can have the disease. So they should be assured that they cannot have the disease due to these vaccines. And then comes a question, once you have received a vaccine, can you roam around without a mask? No, not as of now. One may do so only when the majority of the population has either got the disease or received the vaccination. This means the population has developed the herd immunity. Once you have received the vaccine, you will not be able to get the disease, but still you can harbor the viruses in your nasal passages, and you can spread the disease process in this thing. So these were the queries which we used to have, like the people used to ask about in the general layman public, with which they used to have the various queries about the vaccines, and these are the things. But one thing is, till the time vaccine is going to be available, it is the mask which is going to act as the vaccines. Thank you.
Thank you, Dr. Mahajan, for that presentation. Actually, you have preempted a lot of the questions that I was, in any case, looking to ask you. We have Sunilji with us right now. Sunilji, thanks for making it. Would you want to come in and address the panel as well as the participants for a couple of minutes? Sunilji, you're on mute right now.
That's all with my presentation.
Sure, thanks, Dr. Mahajan. Yeah.
Can you hear me now?
You've been unmuted. Yeah.
Okay. Thank you. So first, big thank you to the senior members of DMC for setting this up, and also, of course, to our own team at the Mind Institute for organizing this. As you are all aware, from time to time, we keep on bringing knowledge resource to people to expand their horizon, to get better understanding, and also to understand a more factual situation rather than getting information only from WhatsApp messages, etc., which very often is either just sensational or overly exciting without actually any factual backup. I'm very glad that Dr. Mahajan gave us step by step on the experience that people have had of COVID. And the purpose of this was, this is a reality of the situation around us. we can neither ignore it nor run away from it. So we have to stand up and face it squarely. And this is what the institution DMC has done. It has the largest capacity to handle patients which are COVID-19 positive in northwest of India. And as a leader in healthcare and in knowledge and innovation and research, it has demonstrated its capabilities again. There were some hiccups that we also had starting off because this is completely unprecedented. It was unforeseen. So no one in the world was quite prepared for this. But the wonderful thing to see is how all society, all institutions, all colleges, schools, homes, offices pivoted to become virtual organizations without actually coming to a complete stop. Of course, during the lockdown, many institutions came to a stop, but the moment they could, they switched over to a virtual working style. The reason that this kind of conversation is critical right now for us is that we must make informed choices now, because we are making choices every day, whether to go out or not, whether to do a thing or not, go to a restaurant, go to a shop, meet with family or friends. So all of these have to be done in a sensible manner. If something is essential, we should do it, but we should do it with full precaution. The need for precaution has not gone away, and by the way, will not go away for quite a while right now, even though the application of the vaccine will start in coming weeks and months, but it is still some distance away until we develop community immunity, or what is also popularly known as herd immunity. And we will see one of three things or a combination of three things happen. One, we will see the virus itself start to weaken or demonstrate weaker mutations of the same virus. As you know, there are many mutations of this virus which are already floating around. Second is that a lot of people will develop herd immunity. And third, that the third part of herd immunity is what happens when you get a quality vaccine that is effective. And I want to echo and reiterate the point that Dr. Mahajan made. There is unnecessary controversy going on about the vaccines. It is a known fact that the origin of the vaccine, each of the vaccines is different. The methodology of producing them is different, but the effect is somewhat similar, because even the one which has the least impact in terms of time is still going to be effective for 3 to 6 months, which is enough to break the chain of the spread of this. And that is why it almost does not matter which vaccine we get. And there is a massive effort going on right now using various tools available to the system in India. One is the tool whereby we currently deploy things like BCG injection when children are born, polio shots. We also have an Aadhaar system. So there are different layers of systems which are being called into play right now to be effective and to try and do this in a timely manner. Also, there is the judgment that has been made by the authority that even if we get, at this moment, India is only tied up for 300 million people, doses for 300 million people only. And therefore, it becomes critical as to what is the priority list as to who will get them. Because they believe even with this 300 million, we will be able to break the chain. And it is, however, completely likely that after the first flush, they will open part of this implementation, including procurement, to the private sector. Initially, the private sector's role is very limited right now, and that will come into play in the second and the third phase, because this is planned in multiple phases, as you may be aware. My other suggestion and request to the doctors is that when you're putting up a screen, don't read off the screen, because you already know all this stuff. Either you talk to us or you show us images of stuff on the screen if you think that is relevant to the conversation that you're having, because otherwise we would like to make it as interactive as possible, and that will be even more meaningful. And I'm not running down what was done, because it was very meaningful stuff that we just went through. in great detail, and I like the way that he ran us through right from the early stage of the disease to now what we have as both the prevention and the cure. So thank you all very much, and good luck and good wishes. I hope you all stay safe and we are all able to become fully productive, having handled this disease in a manner that it's not no longer a great bother for us. But the issue of long COVID is around and will stay with us for a while. And that is why it is absolutely critical that those who appear to have got cured after having got infected over 2 or 3 weeks should, from anywhere from between 4 to 8 weeks, or more likely 6 to 8 weeks, get a full body checkup of every organ, because you have no idea which organ it goes and sits in and it impacts, whether through a cytokine storm or different methods in which it actually is impacting the body. Even today, we are discovering new things about this disease.
Yeah.
It is that new. So checkup of kidneys and liver and heart and brain, all major organs is absolutely an essential requirement. And I've been advising all my friends who have gone through this, who got infected, including people in our own companies. I had a conversation, in fact, with some of them as late as yesterday itself, because we do have now a few people in our own team which have had this infection. Fortunately, nobody has come down with very severe symptoms. Nobody has so far got hospitalized into an ICU kind of situation or required forced oxygen, etc. So thank you all very much and thank you to Alvarez Marshall and to Costa for moderating this. And good luck to all of you.
Thank you. Thank you so much, Sunilji, for taking time out.
Just one more. We must use
session.
this. And this is my message to DMC. And by the way, I've asked for a separate call with all of you. I just told Prakash only 1 hour back to set up a call first with the MAC team and then with the entire COVID team. We must use this as a massive learning opportunity for ourselves as an institution. As much research as possible, as much documentation and archiving as possible, as much interconnection as possible. And I will come back to you with some other suggestions I have on the research front, in addition to this, that I think are real opportunities available to us. They've come to us, as you know, as part of the funding that we do, but I'm happy to connect them with DMC to look at if any of those make sense for us as research projects as well. Good luck. All the best.
Thank you. Thanks, Sunilji. So, taking off from the presentation and also from, Sunilji's address, I want to ask a couple of related questions to Dr. Puri to start with. The first thing really concerns the sliding numbers of overall cases, positivity, fatality rates in India, at least over the last couple of months, and naturally there is a growing sense of both hope and exuberance in the population as you see the overall numbers come down. What do you think are the true factors at play, which is leading to say the numbers essentially coming more under control? Is it really herd immunity already starting to play out in these micro markets, or are there some other factors at play?
Well, I think there has been a massive propaganda by the government, both state and national level, in order to sensitize the people about the way this disease is transmitted and spread and the measures to control them. Well, if you compare us with the Western or the European population, maybe we've not been that conducive to using these methods. But yes, the numbers have been declining. But I'll leave it to the scientists to come out with theories, because we've been baffled all these 7-8 months that this disease has been here. When it was the summers, people were anticipating that in the summers, the virus will go down. And then came the winters, and one was expecting the second wave to be as severe or as bad as they're seeing in Europe and US. But if you see the India numbers going down every day and the state numbers going down every day, whether the herd immunity has set in, we don't have a scientific basis for that. There are studies which have been conducted that people have seen that there is a seroprevalence of around 25 to 29% in various population groups that they've tested. But that doesn't classify for herd immunity. Well, if it has actually set in, and that's the reason why these numbers are declining, I feel more safe. But we still would have more scientific basis only in the times to come. We were again anticipating a peak coming around the mid of December, but we are actually facing a decline. So I really don't have a very objective answer to your question, but let's hope that it's the herd immunity which is setting in.
Got it. Got it. And even as numbers decline, I think, specifically I wanted to ask, especially for comorbid patients or octogenarian comorbid patients, the risk factors continue to be quite high, right? So what are the must adopt precautionary measures, especially for those patients, more than, regular young people? Can you just, throw some light on that?
Yeah, I think it's the most important thing. Last almost 9 months, we've been battling with this pandemic. Now there are so many things in sight. There is a vaccine in sight, which is probably going to be there in India as well. There are treatment strategies which have come up. If we compare ourselves with the people who've been treated in March and April versus those who were treated in July and now lately, there is a significant improvement in their outcomes as well. So how are we going to protect ourselves? I think Rajesh in his presentation, when he ended, he said, as of today, the mask is your best vaccine. So let us not, be light right now. We should be very particular about the usage of our mask, about our hand washing, about our physical distancing. I think the government has done a very good job, whether it's your phone tunes, whether it is the other social media, they've kind of projected these things. And I think we should not let our guard down. These are the most essential things. Most patients we come across are those who would report an exposure which occurred inadvertently, that I was wearing this mask for all this time and then there was suddenly a get together and this happened. So these three things remain the cornerstone of protecting yourself: the mask, a physical distance, and frequent hand washing. And this would be till you're vaccinated, until the time this disease becomes just like any other common ailment and it's not that kind of vicious and serious to your body organs.
Sure. Thanks, Dr. Puri. The other point that I wanted to, get your thoughts on is obviously the second wave in Europe has been quite virulent, and Sunilji did talk about the fact that the subsequent mutations of the virus may actually be losing a little bit of its virulence or strength. What should we really expect in India, Dr. Mohan? I mean, do you actually expect mutations to lead to a much more virulent second wave come January, February? Or do we really believe that the worst is behind us, or our immune systems are programmed to work in a slightly different way versus how it works for Caucasians? Sorry, Dr. Mohan, you're on mute.
Am I audible?
Yes, yes.
Okay. Let me just add on to the first question that was very relevant, that all of us are surprised at why our numbers are less in India. If you read, there is a recent survey and one of the detailed report about the testing, the ways of testing done in the different part of the country. See, the sensitivity of the testing of a PCR and a rapid antigen test is a long debate for the last 9 months. But it has been found that rapid antigen test missed many positive COVID patients who were milder, but they were missed. So the numbers is one of the reasons that the methodology it varies from state to state. So where the rapid antigen tests were used, the kit was used, the numbers were less, and in other countries, in the other states, the pickup rate was more. That is one of the additional
I
points I
see.
just want to make. So the methodology is very, very important. For that, Andhra Pradesh, Karnataka, and Punjab are the three states which have used maximum PCR. So the type of testing is very, very important. That's one point I just want to add to this. Second, which Dr. Puri was saying about the 3 points which are very relevant about the comorbidities. and the elderly patients to have is mask, social distancing, and hand wash. It is another point I just want to make up that in this era of co-infections of particularly the viral infection and influenza, we should strongly promote, till our vaccinations comes for COVID, we should promote the influenza vaccination and H1N1 vaccination to all the patients who are at high risk, particularly patients above 60 year, diabetic, cardiac patients, or the other comorbidities. So they should have, a shot of influenza vaccination, which is easily available, readily available in the nearby any health sector. So at least it will protect our elderly persons from secondary infections. There are reports from US, if there are co-infections of influenza and the COVID together, it can be worse. So that is my advice, along with Dr. Puri's, all 3 points, that they should have some vaccination of, influenza to protect that. That's a very important point I just wanted to make. You're coming to your question about the second wave, which we are discussing about the severity and the mutation. There are till now there are 450 mutations have happened in the COVID. 450. But the important thing is they are point mutations. See, it is a M spike protein of the COVID virus, which causes all the crises when it acts on the some receptors outside. And when these mutations occur, the character change, it is their, we can say, their sequence of these molecules change, and then we call it mutation. This mutation can be, making the disease milder, but it can be on the other side. But till now, there are 450 mutations, but none of them is shown to be worse. But there is a one concern about the infectivity, not the severity. We should differentiate from two things. One is the severity of the disease, that whether it is involving the lungs, or the infectivity, whether this mutation is producing more infection. Recently, you must have heard about the, the epidemiologist from the England. They were saying they have found a mutation in some suburb of the London where the infectivity was higher, but the severity was low. So it's a cycle of the pandemic. When the second wave comes, initially the last pandemic showed the second wave was worse than the first wave. But here we were expecting, because of the temperature, because you must know that this virus multiplies and it gets more severity where temperature is less than 10 degrees centigrade. So we were expecting, particularly in the northern part of India, this is going to be worse. But remember that we have seen less number of patients, of COVID patients, but if you see the death rate, it is either same or it has increased. See, take an example of Delhi. Few months back, Delhi was producing 3,000 of COVID patients, and death rate was, mortality was around 1%, 1 or 1.25%. But in the recent 2 weeks, when the winter has come in, the death rate has come to 2.5. It is much higher. So that same thing is happening with the Punjab, and similar thing is, replicated in Himachal Pradesh. So my fear is that we may be having less number, but the disease severity is still there, and maybe it may worsen in the coming month.
Got it. I think that's very helpful, Dr. Mohan. So what you're really saying is that mutations could also take us the other way, right? I mean, it could actually impact both the infectivity as well as the severity, and therefore the fatality of this virus as we go ahead, and therefore we should not be taking our guards down. I think that's the limited point that you're making. One other point, related to Dr. Mahajan's presentation, and also a point that Sunilji made, was really related to long COVID, right? Long COVID symptoms. In my own case, I mean, I suffered from it at the end of May, early June. And in my case, those issues with lung aches, severe fatigue, muscle aches, body pain continued for almost 3.5 months. So while in journals I was really reading about people having long COVID for a period of 6 to 8 weeks, in my case it continued for almost 14 weeks, right? And obviously, advised by doctors, I did some tests, right? I basically did some CT scans and stuff. But it would be good to hear from you as to what all are the must-do tests that one must undergo, especially if some of these conditions or symptoms linger. Because I don't think, at least in my case, I got very good advice with respect to all the absolutely must-do tests that one must undergo to rule out any potential impact on any of the other organs?
Kaustav, this is a very, very relevant, and I think it's one of the most important question which is going to haunt most of the physicians in the next 1 year. And the people believe that their clinic will be full with the post-COVID long syndrome disease, because as such, the infectivity and the involvement of population, even if it is 10%, it comes out to be 15 crore Indians having post-COVID syndrome like of scenario. So this post-COVID or a long COVID syndrome, we see, by definition, we say anything, the symptom which goes beyond 3 months, we say it is a post-COVID, long COVID syndrome. This is the new definition has been given to that. So then we have to differentiate between the two phases. First is the acute phase, as you said. In the acute phase, we have whether we have a lung involvement or a non-lung involvement. If our lungs are involved, then we can have a subacute kind of a scenario that after 2 weeks, once patient recovers mildly, then he goes home, and then he comes back with the three possibilities. One is he becomes totally normal, his lungs are totally clear, chest is totally clear and no symptoms, and he's asymptomatic. Second is there is some superadded infection, or there is a problem of the COVID which is a prothrombotic. We know that COVID also produces a clot formation or enhances the formation of the clot. Either we can have that, complication of that in the form of, some clot in the lungs or something like that. Third thing is that whether because your lungs are involved, we have seen that in these particular of patients, the normal course of pneumonia, in general pneumonia, whatever we see, that after 2 to 4 weeks, the patches disappear, lungs becomes parenchyma normal. It's a great healing. It's a natural process. But what we have seen in the COVID patient is that some subset of the patients, they produces fibrosis. Fibrosis means thickening in the lungs parenchyma. It's a
Yeah.
septal thickening. There are different things. I'm not going into detail of scientific thing, but we have to understand it is known as fibrosis or a thickening of the lungs. That becomes a permanent scar, and sometimes it produces symptoms for a long time. So that is the third thing for an acute stage. And the long COVID, now come to our second question about the complication. The complication, as Mr. Munjal was saying, that it can virtually involve any of the organs, because the reason why it is this is because there is a specific protein that is known as M spike protein of this virus, which sits on some receptors, wherever the receptors are, ACE receptor, which are more in the lungs, endothelium, and in the cardiac part, and sometimes it has been seen in the neurological or in the kidney vasculature. So wherever these receptors are there, it can leave some residual effect, or it can promote injury to those lining, the typical lining of those cells, which can produce further complication in the form of inflammation, in the form of clot formation, or it releases bad chemicals. I would say bad chemicals which further cause complication in the body. So that means there are few studies I just want to share with you. One is the DMC is running a World Health Federation calibration study with 62 countries. We have seen in 400 patients with a follow-up. The 40 patients means 12% of the patients we lost in the next 3 months.
Wow.
Yeah, this is a very, very serious concern to all of us, because they had a complication either because of the secondary infection or their oxygenation was low, leading on to heart attacks. These are the severe kind of patient which I am talking about. For a mild or a moderate patient, as you said, you had a milder disease, the chances of problems are very less, but still it is there in the form of fatigability, in the form of mild involvement of the heart tissue. It has been seen that there are certain enzymes, whenever there are COVID effects on the body, the enzymes from the heart like troponin or CPK, they releases, and it can cause minute fibrosis that can be picked up only by MRI. So there is an MRI study. They have seen that 10% of the patients who were not that symptomatic in the COVID had some kind of a scar in the heart. This is a Toronto study, and even they did a biopsy subsequently. They show that there is some complication. What is the clinical outcome or effect on the body? We don't know at present. But only we can say that this milder or a moderate disease can have impact on the organs, which we don't even think that it will affect. So that's the importance of having a follow up those patients and to explore that what are the long term complication of these patients.
Thank you. I think that's a very comprehensive answer, Dr. Mohan, and I'll definitely be in touch with you as I move ahead on my journey. Moving on to the other subject of vaccination, right, and the effectiveness of vaccines. I think we all realize that there are so many different technologies that are really being
Yes. Kaustav, I think, Majan, can we answer that? Okay.
am I audible?
Yeah.
To move on to the next of the vaccination program and vaccine efficacy.
Okay.
And what I was really saying is that there are so many different technologies being tested by vaccine developers, right? Nucleic
Yes.
acid based, viral vector based, protein based,
Okay. So
and
let me
so on and
just
so
make,
forth. How,
I think Dr. Mahajan has touched most of this in his talk. So let me simplify it for a person like me, who is a cardiologist, who has less knowledge about vaccine, and these guys have more knowledge about the vaccine. So what I understand as a common person, that what the vaccine's efficacy means. See, the first thing historically, I just want to share with you, the historically the vaccine was started in India, China, and the Middle East, thousands years back. It looks surprising, but it's well written in the ancient books. The smallpox crust, they used to take this crust and they used to scratch the normal person, and they used to take scratch the crust of the infected person, and then through this scratch this crust used to go in the other side, and this used to produce a local reaction, and this showed some response at that time, the positive response and immune response. So what vaccine is? Vaccine is that a body system tells the system in the body tells that something foreign is come in your body, and be prepared for that. So once it comes, next time the body cells, they're strong enough, they have a memory cell in the body which attacks of that foreign body and kills there and then. So this is the simple fundamental of a vaccine. Now there are different ways of vaccine which I just shared with you. That is a simple, inoculation with the skin scratches was at that time. First vaccination was done in 1798, I think, Dr. Edward from England, of a smallpox. That they injected, some cowpox vaccine, dead virus into the as an injection, subcutaneous injection, and that was in the history of a vaccination at that time. So what are the different types of vaccine, and what are the good or bad things about the vaccine? There are two well-known vaccine. One is a live vaccine. Live vaccine means the virus which is producing a disease, but in that the harmful impact of that area
has
at the
been
dose is less, and that
yes.
is injected. The most example is a polio vaccine, that is in a live vaccine, right? Then there are other types. Again, there are some types of polio vaccine or inactivated vaccine, that is known as a dead vaccine. That means the dead virus in a particular amount is taken, and that is injected. It's very clear that when you given a live attenuated vaccine, the response is going to be more, but at the same time the efficacy is going to be more rather than the dead vaccine. So what is the difference? So how to choose between them, which is better for us? In a immunocompromised persons, like in a cancer patient where the immunity is low, the live vaccine can cause some side effects. That is the history, and that is the example. And the dead vaccine, though efficacy is less, but the side effects are less. So it means that you need to put a booster dose every year for that. But these vaccines takes years together to develop. See, like in a papilloma virus, we know that it took 7-8 years to develop that vaccine. So in the COVID, since it was involving massive population, something different has to be done. That's why I'm coming to your question. Then there is a new technique which is being used first time in the history. That is the virus was not taken. Only one component, that is RNA, was taken. This contains of a molecules that was engineered the same shape of COVID RNA, and those RNA was taken into a particular amount, and that was experimented. That's why we are able to get these vaccine so fast. Otherwise, there was lot of criticism that it is not possible to have a perfect vaccine in 1 year. It is almost impossible. So this is only this technology which is helping in a lot in the world, like an RNA vaccine, that is the Pfizer vaccine, which is helping us to produce the same immune response from the host, and to make that antibodies, and to have that thing in the memory cells, so that once any foreign particle comes inside of the COVID, it acts accordingly, and then it kills the bad effects of that COVID virus. So this is what the RNA is. Then
Got it.
there is one other vaccine is in a DNA that India is trying to make, the Zydus in Hyderabad.
The Zydus one.
Yes.
Okay. Okay. So one of the related questions that I have, and either of you or Dr. Mahajan can answer this question. I think Sunilji did talk about the fact that in order of priority, there is a list of whatever 30 crore people who ideally need to be vaccinated. As far as the public vaccination program is concerned, right? They're going after the frontline health workers, other frontline workers, and then in order of priority, they are going after comorbid people in the greater than 50 and less than 50 age brackets. What about the rest of the population? I mean, do you expect them to actually get access to vaccination through the private distribution system? So people like you and me, will we actually have to go to a hospital or a clinic and then make choices in terms of whether I want to go for the Sputnik Dr. Reddy's vaccine, or whether I need to go for the Zydus vaccine? How should we be thinking about those choices if we are actually required to make those choices?
See,
I mean, purely from a clinician perspective, what would be your guidance or advice?
See, there is one thing very clear about this thing, that till now our system is geared up to give vaccination into 2.5 crores of population. If we talk about the polio vaccine, because less than 5 years we have this population at risk, and our system, polio system, I think is praised all over the world, that we were able to reach at the the at, at I would say the every end of the country to give that vaccine. But now we have a population of more than 100 crores. So to give, suddenly increasing that particle from 2 crore to 100 crore, it is not going to be possible anywhere in the world. Even the USA feels that they will be able to handle half of their population in the next 6 months. You must have heard that a talk by President Biden when he took over. So then once this thing happens, then we have to find out the persons with our prior knowledge in the last 9 months, who were the persons who died because of because of the COVID. We have seen that persons who were more than 60 years of age, persons with having a history of diabetes, obese, CKD, kidney problems, and some of the patients who are having a prior lung problem, they were at a risk of death mortality. If we talk about the younger generation, the mortality rate, the death rate of a younger generation is 0.0008. It means hardly any young patient without comorbidity is died because of the COVID. So obviously it becomes itself a explanation of your question, that these population do not need vaccination at priority or even at all. And
I
most,
see.
and the second thing is that this vaccination is not being studied in the children, in the lactating mother, in the pregnancy, because as I said that this is the RNA vaccine. Nobody knows the long term outcome of this vaccine. We don't know whether this RNA can sometime mutate inside, or can do some side effects with the lactating or the childbearing ladies, and can cause some complication. We have seen one example is there long back, a WHO vaccine for sterilization, which is in ban now. It has shown some bad effects. So these much of a population do not even require vaccination.
I
As a
see.
clinician, I strongly believe that the children, youngsters, and the group which I have discussed, they do not need vaccination at all, because they are at the lowest of a priority, or they do not need, because the our epidemiological data clearly shows that the death rate is almost negligible in those uh, persons who are younger
Got it.
and healthy. Dr. Mahajan, you want to add on to this? Dr. Mahajan?
I think, Bishop, you have covered each and everything about this thing. There's nothing
Yeah.
to
So a quick final couple of questions from my side at one go before we open up to the audience. One is, obviously as a recovering COVID patient, and Dr. Mahajan, your presentation did talk about the fact that even recovering COVID patients can be vaccinated, but there are some theories going around that because you're recovering, I mean, even when your antibody levels go down, your B cells still retain the memory of how to tackle the virus, right? In that kind of a situation, should somebody like me go for vaccination or not? So that's one question. And the other question that I had was really, as a country, what kind of overall timelines should we really expect, not only for that public vaccination program, but when do we expect the relevant part of the population to actually get access to vaccines and actually get vaccinated? So I know it's a question on everybody's mind, but what's your thought on this would be good to understand.
The thing was ki like I think Bishop has already answered these queries because the thing is ki in India you don't have that much infrastructure that you can vaccinate all the total population in one go. Definitely, even the government has prioritized. I've given that they are already having 60 crore doses which they have already procured, and out of that 1 crore is going to be the healthcare workers, 2 crore to the all the paramedics, and 27 crore which they have said it is going to be going to the people who are having underlying comorbid illness. How much the normal government people are going to get, nobody knows about that. When the people are going to, government is going to give the approval to the other companies, because everybody is asking for the emergency approval of the drugs. Until today, we are having the robust data from the Pfizer and the Moderna. Serum Institute is doing our studies, but it has not been approved even in the UK because they are partnership with the UK government. The Indian government, with the ICMR vaccine, which is going to be developed, we don't have that. They have just completed the phase 1 trial. So you can expect that it is going to take December 2021 or even June 2022 when you can expect that a whole of the country can be vaccinated. Then comes the whether your people are going to get vaccinated. There's so much data which has come up that the 53% of the Indian population, they have done the surveys, they don't want the vaccination. So it's a very big question mark that when the people are going to get the vaccine and how many people are actually going to get vaccinated. So that is the thing. Till today, we don't have even any company with even the Pfizer and the Moderna has not got the approval from the Indian government.
There was one question in the chat. Can I answer quickly? The time is
Yes,
running.
I was just referring to that.
There is a mutation. There is a question that COVID is having mutation. So whether vaccine is going to help us or not. Vaccine, as we said, that it is based upon the protein. So it is a large protein, and the mutation is a point mutation. So even if we have a 10 or 15 or more than 100 mutations, it is a large protein. So it is a big protein. So it is unlikely that this vaccine is going to be ineffective till now. So one vaccine, any vaccine will cover immunity, required immunity.
Got it.
I just want to add one more thing which you
Yeah.
earlier asked. I think Bishop just skipped that one. The thing is, you were asking about what are the tests which you have to get in case if somebody is having the long COVID or the post COVID.
Yeah.
Now various literature like Dr. Bishop has already highlighted that you can have the breathlessness, you can get your lung function test, you can get the cardiac function. One is the endocrinological disorder, which we always used to skip. Like virus can affect your thyroid hormone, your pancreas. People can develop the diabetes, they can have the thyroid problem. And in the males, they can have the testicular failure also. So after 12 weeks, person must get here their thyroid profile, their cortisol level, their testosterone level, along with their electrolytes and calcium. So this is another addition which I just want to add to Bishop's comments.
Sure. I just wanted to open up for some questions from the audience. Anshul, do you want to come in and have those questions voiced?
Okay, we've got Mohit Dhawan who has a question for the panelist. Yeah, Mohit, please go ahead.
Sure. Dr. Mohan, thank you. And Dr. Mahajan, thank you very much for a very informative session. I think Dr. Mohan, you touched upon this, but most vaccines take a long time to develop, and given we've developed this vaccine in a very accelerated time frame, could you comment a little bit more on? You touched upon it, but could you comment a little bit more about the safety aspect of the vaccine? And a lot of people are concerned about taking the vaccine. I think Dr. Mahajan also mentioned.
Yeah, Mohit,
Can you just touch
you're
a little bit more about that?
Yeah, you're absolutely right, because most of this is the shortest time a vaccination has been, produced. So that's why nobody is saying making it a mandatory, number one. Second, FDA has given its clearance only as an emergency use, not as a, absolutely cleared without its long-term side effects. So, but till now, whatever the side effects we have, it seems to be safe at that point of time. So it is an option given. It is not that it is must for everyone. Even in India, it is an optional vaccination, and then it is not cleared for, it is not part of any national immunization program. That is one important thing. And second is, I was just listening to one of the vaccinology professor who is part of at least 5 vaccines production. He was saying that the first vaccine is usually not the perfect vaccine. So I'm not demoralizing everyone, but you're right that we should keep in mind the long-term side effects. Till now, there are not much of the side effects have been found, but we should be aware that it is possible you can have some of the side effects in the long run, which can be only known with the time frame.
Mohit, I just want to add one thing is ki definitely the results have been very quick, but the platform which has been used was available for the last 15 years. They were also earlier developing the vaccines for the various viruses. So this was another thing ki they have compromised on the results, but definitely we not long-term effects are not available in this thing. But platform was available, so that was the reason. Once the China published the genomic sequence in the January, the companies were already doing the work on the vaccination program. So that was the one thing. So that's why you had a so quick vaccine was available.
Thank you. This is helpful.
Anshul, can we move on to the next question?
Yeah, we have Mr. Nagaraju who heads the Hero Homes for us, right? Yes, Nagaraju sir, please. Can we have the
I
question?
would like to first, thanks. I would like to thank the panel for a very informative discussion. I was just wondering, although, this we touched upon during the discussion, but I was just wondering, over the last couple of months, we have had festivals, we have had elections. We are right now in the midst of farmer agitation all over the country. So there is, if you look at it, huge congregation of people happening everywhere. And on coming Monday, I think there is a huge rally proposed in Mumbai. But despite all these events, we are seeing a decline in the number of cases. Is it that we have developed some sort of immunity already? Because some of these sero surveys are pointing out to the fact that about 30%, 40% people have antibodies in them. So is it that some sort of immunity has already been developed amongst people?
There
Is
are
it the nature of the bodies is different in India as compared to the Europe?
there are two explanation of this. One is, as I said, that the methodology of testing was variable from state to state and in the country. So it might be possible that we have lots number of zero positive persons in the different parts of the country. As that 5% was the initial estimate, then it came 15%. Now the latest data we have in our state, in Punjab and in the metro, is in some of the area it is 70 to 90% zero positivity. So that high. So that is one thing. Second thing is that people are looking now in the different area in the world, that there are some race. It depends upon your genetic constitute, that how much of we are, it depends on our immunity and the genetic system in the body, that how many of us are prone to the infection, number one. Number two, what is our response is going to that infection. If we see that in UK, the southeastern Asians, the death rate was highest in the health workers there, and same thing in the blacks, it is much more in America as compared to the whites. So there may be something more of that, because it is a typical case, I would say, in a PhD thesis, that thousands of farmers are sitting none of them are wearing, mask, and we are not able to see that spurt of cases which we
Infection.
used to expect. So there are a number of variables. There is no clear-cut answer to this.
Right. Thank you. Thanks, Doctor.
We now have Mr. Rakesh Kumar, who is also a COVID survivor, COVID fighter, I would say. Right? Can we have the question for Mr. Rakesh? Yeah.
Yeah, hi. Thank you so much for the to the doctors of DMCH for the informative session. My question to the doctors is that there is a myth right now in the minds of everyone, someone that that this disease will not happen to anyone twice or the second time, right? So people are moving around once they get positive, uh, they are moving around without hesitation. So my question to doctors is it what are your experience for the second timers, and when you come across with a patient of say second time patient, are you treating him something differently, or some specific suggestions you are giving to those patients?
Cannot say that this disease cannot happen, because there is enough literature which is available now that the reinfection and the relapse can be possible. Definitely, you are going to have the antibodies level for at least 90 days. It has been documented, and that's what I even mentioned in my presentation, that after 90 days, definitely you can have the reinfection. So that's why we were saying the vaccination is not mandatory for those people who are going to have this disease in the first 3 months. The people who are going to have the disease, secondary infection or second episode can be mild one, or it can be the severe one. So in case if the severe one is there, you have to manage as the acute attack of the COVID, which we used to have the earlier. But sometimes immune response can be very vigorous one. So you can have the severe disease at that stage. So you have to take all due precautions. So that's why they used to say the mask is the one which is going to be the one which is going to help you out. And I think that is going to become the part of our life only.
The second question, just followed question on this, doctor, is that here many doctors are saying that the second test, once you get infected, the second test is not mandatory for you if you are if you have completed your quarantine period, right, after 15-20 days.
Normally the government of India doesn't ask for the second testing. Normally they say in case if you have done your quarantine period of 14 days, you don't require, because the thing is even the test can be positive for a couple of weeks again. But the thing is whether you are infective to other people, why the quarantine is required, just to stop the infecting other people of your family or in your community. So once you have covered the 14 days of the quarantine of the one test, and in case if the people have got the test and they have got the CT values, it is the viral load is very low. So that's why they say repeat testing is not required in the general public.
It's a very, very important thing. I think it's a total wastage of your money and a stress, because even a dead virus will be positive. So it will create a psychological impact, and the scientific data from the CDC is very clearly shown recently in the 99 centers they have studied, that none of the patients after 10 days were infected. So be very clear about this thing, and India has made it 14 days. So after 14 days, there is no need of test, and there is no chance of infection of one person to other person.
Thank you so much, doctor.
Okay, I think we'd probably now take the liberty to bring the session to an end, or do we have one final question from Sunil?
No, Sunil is gonna express the word of thanks.
Okay, sure. So quick word from my side. Once again, Dr. Puri, great reconnecting with you. Hopefully we'd once again meet in person sometime soon, and big vote of thanks to Dr. Mohan and Dr. Mahajan as well for taking time out from their busy schedule and really being on the panel for such an enlightening discussion. Sunil, over to you. Thank you.
I think on behalf of Hero family, I must thank all the senior members of the DMC, Dr. Puri, Dr. Mahajan, Dr. Mohan. I think you've beautifully summed up, and extensively covered the various facets of COVID prevention as much as cure. And true to the topic, integrated and holistic perspective is what we have got. I'm sure all of us have found these inputs very meaningful and informative. I would also like to thank Mr. Ganguly for not just moderating the session, but you could actually bring on the forum very important questions which are so useful for all of us. I must thank all of you for investing your time to get these insights. Wish all of you a very happy and a prosperous new year. Stay safe, stay healthy, and stay tuned with us in this learning journey, third Saturday of every month. Thank you very much.
Thank you. Thank you, everybody.